Welcome to the Data to Policy course. Vital Strategies, together with CDC and CDC Foundation, is responsible for carrying out the Data to Policy arm of the Data for Health initiative. The Data for Health, or D4H, initiative is funded by Bloomberg Philanthropies and the Australian Department of Foreign Affairs and Trade. The Data for Health initiative is being carried out in more than 20 countries and cities around the world through technical assistance provided by multiple partner organizations, including the CDC, Johns Hopkins University, and the WHO. The Data for Health initiative has 5 components: enhancing civil registration and vital statistics systems, enhancing the collection of data on risk factors for NCDs through a mobile phone survey, enhancing population-based cancer registration and reporting, the Data Impact Program, which focuses on how existing data can be most effectively used to produce maximum impact on public health policymaking, and the Global Grants Program, which provides funds and technical assistance to countries to enhance their systems of data collection and use. The Data Impact Program itself has 4 components, and some of you might be involved in some of the others. These include the National Public Health Bulletin, scientific communications training, a policy forum, and the training we're about to start, the Data to Policy program. The Data to Policy, or D2P, arm of the initiative is a capacity reinforcement program meant to equip mid-level Ministry of Health, or MOH, staff with the skills to develop a policy brief. This intensive, mentored program bridges the gap between public health professionals and policymakers by training public health professionals to develop a policy brief. The program builds key competencies in multiple areas, including in conducting literature reviews, identifying and using data from multiple sources, data visualization, stakeholder analysis, and policy writing. Participants learn how to use public health data to develop evidence-based, targeted policy briefs that will lead to high-impact, lasting change and tell a compelling story that supports the need for such change. What makes a good policy topic? Health policies are developed to address recognized, well-defined problems facing the public. Policies should always be developed in response to data that show clearly that a problem exists, that show that the problem is of high burden and/or of high public importance, that there are modifiable underlying root causes of that problem, and that a specific intervention can mitigate that problem. For example, a country might recognize that they have an unacceptable burden of traffic fatalities caused by low use of safety belts, recognize that one root cause is an absence of laws requiring safety belt usage, and wish to develop a policy to instate and enforce laws about wearing safety belts in vehicles. Policies can be a broad number of things. They can include health-related laws, such as those enforced by MOH or ministries, for example, cigarette taxes and mandatory seatbelt use, those that apply to the health system, such as universal health coverage, regulations set by the MOH or other ministries, such as MOH regulations, for example, changes in health worker training or treatment guidelines, and regulations set by other ministries that impact health, such as environmental regulations and eligibility for school feeding programs, and strategic decision-making for health programs, such as resource allocation, such as increasing the funding allocation for disease prevention activities for a specific high-burden disease or for a high-burden geographic area, requests to external funders, the Ministry of Finance or national assemblies for program funds outside of the existing MOH budget, and program planning, for example, developing new interventions and adapting existing interventions. Regardless of what type of policy you work on in this class, know that the outcomes are meant to be data-driven policy briefs related to Ministry of Health priorities, a cohort of staff with increased capacity to develop evidence-based policy recommendations, and institutionalized training that your country will eventually implement on its own. So, how and why are health policies made? Health policies are developed to respond to a health problem. Often, we conduct health studies to investigate these health problems. Here, we'll use a pile of rocks to represent the size of a particular health problem. Health studies can show how big a health problem is, but they also tell us about specific risk factors for the health problem. That is, what actions or behaviors increase our risk for the health problem? What makes the problem bigger or worse? Some of these risk factors also represent the root causes of the health problem. Once we know what the risk factors or root causes are, we can start to think about how to design interventions that address those root causes and make the problem smaller. Interventions that target the root causes of the health problem are the basis of policy briefs. That is, we write policy briefs about interventions that affect the root causes of a problem, and in doing so, reduce the size of the problem itself. These interventions are often included in scientific manuscripts in the form of recommendations that are usually found at the end of the manuscript. Let's look at a mock manuscript on incidence and risk factors for child vehicular deaths in country X in 2015. In our manuscript summary, we see that 4,500 children die in car crashes each year in country X, and another 15,000 require hospitalization for their injuries. Our study finds that the biggest risk factors for child death in car crashes is the lack of seatbelts, poor use of seatbelts when present, and low use of car seats. We additionally note that there are no laws that regulate these factors. A paper like this would most likely recommend that car manufacturers be required to put in seatbelts, and that parents be required to use car seats for children of appropriate age. In addition, the paper might recommend that these become laws that are enforced nationally. However, that's where it would end. Authors of scientific manuscripts can study an issue and make recommendations, but policies are needed to stimulate change. Health studies provide direction, but not action. The recommendations in this paper direct us toward possible policies we might want to implement to address this issue. Now that we have an idea of where policy options come from, let's look at a real-life example of how a problem and its possible solutions were turned into a policy brief. Our real-life example comes from Zambia, where the first round of the Data to Policy training course was conducted in early 2016. The policy brief we'll present was developed by participants in this D2P course. In Zambia, in 2015, 36,000 HIV-infected children were unaware of their HIV status, meaning that they weren't receiving treatment for their HIV infections. Although there were national recommendations to test all children for HIV at clinic visits, only 3% were tested. Studies have shown that if HIV-infected children aren't treated, 75% of them will die before they're 5 years of age. What can we do about this? Because Zambia's Ministry of Health had prioritized this as a problem, one of the D2P participant teams was assigned to write a policy to address it. Let's look at the brief they made and see how it relates to what you'll be doing in class. Here is the policy brief written by staff at the Center for Infectious Disease Research in Zambia, also known as CIDRS. In the Data to Policy course, you will be writing a brief that looks very similar to this, although it will be on your particular policy topic. Let's learn a little bit more about what we'll be doing in the D2P course and see how what you learn in the course ends up in a policy brief. One of the first things you'll learn to do is write a problem statement. The problem statement describes the problem and shows how big it is, where it's happening, and who it's happening to. It also often lays out the primary cause of the problem, something we'll learn more about in the D2P course. The problem statement is especially important because it's your primary opportunity to convince your audience to engage. In the problem statement, you need to call attention to your problem clearly. you want to emphasize the importance of your problem and tell your audience of policymakers why they should care about your particular policy issue. On the first page of the Zambia policy brief about testing children for HIV, we see the problem statement. Highlights of the problem statement include: there are approximately 36,000 HIV-positive children not being identified through HIV testing annually. Only 3% of children visiting clinics are tested for HIV. And, if left untreated, 75% of HIV-positive children die by the age of 5 years. With 36,000 children not identified each year and 75% of them dying, you, as a policymaker, might do some quick math and realize this means that 27,000 of these HIV-infected children would die by age 5. Although they don't include those numbers here, that's a major health problem, and it's likely to make you care and want to take action to prevent those deaths. While many policy briefs will explicitly state the numeric burden of the health problem's outcome, that is, the 27,000 child deaths, that isn't mentioned in this brief. But it is one way to add information to the problem statement. In the D2P course, you'll learn how to take your policy issue and write a convincing problem statement. Remember, the goal of the problem statement is to make the audience care about your issue. Another thing we'll learn in the D2P course is how to identify the root causes of the health problem. To do this, we'll first need to identify the primary cause of the problem, and then to identify the causes of that cause. This isn't as difficult as it seems. Your mentors will help you through each step. You'll be likely to find many root causes of the problem, but you want to make sure that you focus on identifying the most important ones. To do this, we'll first ask which of the root causes can you most easily address, and which cause, if addressed, would be likely to have the biggest impact on the problem. Remember that the health problem in the CIDR's brief is child deaths from untreated HIV, and that's primarily caused by low rates of testing children for HIV. But why aren't children getting tested? On page 2 of the brief, they highlight several causes of the failure to test children for HIV, including that HIV-exposed children, after reaching 1 year of age, no longer receive regular testing. Children of mothers who did not attend antenatal clinics do not receive routine testing. Healthcare staff are reluctant to ask permission to test a child, and mothers refuse testing if they don't have the father's permission. There are likely even more root causes than this. Sometimes we identify 10, 20, or even more root causes for a health problem. In the D2P course, you'll have an exercise to help you determine the root causes of your particular health problem. Eventually, we'll select one or just a few root causes to focus on as we develop our policy options. Understanding the root causes of the problem is critical because it allows us to start to identify policy options or ways to address the problem. All policy options must reduce the influence our root causes have on the problem. Sometimes this involves an intervention that simply goes around the root cause to address the problem directly. Other times, our interventions affect the root cause itself and reduce its impact on the problem. No matter what, our policy options must reduce the influence of the root causes on the problem. If our policy options don't reduce the influence of the root causes, we can't expect our policy to reduce the problem. We saw earlier that most of the causes of low rates of HIV testing of children in Zambia related to discomfort with proactively asking for testing, either discomfort of mothers or discomfort of healthcare staff, as well as the lack of routine testing after age 1. In the CIDR's policy brief, on page 3, they identify 3 policy options that directly address these root causes. The first policy option involves routinely testing all children ages 1 to 10 visiting healthcare facilities with the caregiver. This means that the caregiver no longer has to request HIV testing, and the healthcare staff don't have to suggest it. It's done automatically. It's easy to see how this could potentially make a difference in testing. The second policy option recommends regular testing drives at preschools and primary schools. This would enable at least some under 5 children to be tested and, if found positive, put on HIV treatment. We can also see how this would be useful. Finally, the third option is screening at primary school entry. This option includes testing all children for HIV when they apply for primary school, together with other standard screenings, such as for developmental problems, hearing or vision problems, missing immunizations, and malaria. We can also see how this could potentially identify some children with HIV infection who are still undiagnosed, although most children are close to age 5 by the time they enter primary school, so this option might miss children who died before age 5. In the D2P course, you'll be identifying your policy options, focusing on ones that address the root causes of your public health problem. Once we've identified our policy options, we need to compare them to each other. Not all policy options are equal. We evaluate our policy options on 4 metrics: the expected health impact of each option, the budgetary impact or cost of each option, the economic impact of each option or cost effectiveness, and the feasibility of each option. Feasibility comes in 2 forms: political feasibility and operational feasibility. Operational feasibility means how easy would the policy option be to implement? Does it involve new staff, new buildings, new infrastructure, or new processes or laws? Does it make use of existing resources or infrastructure? Political feasibility refers to how much support you can expect from people in power. Just because something is cheap or cost-effective doesn't mean it has to be implemented. Sometimes we have a cheap and effective policy option, but because it's not as politically feasible as a more expensive or less effective option, it won't be prioritized. All of these have to be considered when we evaluate our policy options. Pages 3 and 4 of the CIDRS policy brief deal with the feasibility of each option. For Option 1, routine HIV testing of all children at health facilities, the policy brief states that the feasibility is medium-high, noting that it builds on a current government initiative to identify HIV-infected children. However, they note that implementation of this policy option would require a reinforced legal framework to support this approach: community sensitization, more trained counselors, and more HIV testing kits. For Option 2, HIV screening drives at preschools and primary schools, the brief also states that the feasibility is high and notes that it would require community sensitization, funds, transport, human resources, orientations for schools, and a collaboration with the Ministry of Education. Option 3, the entry screening for primary schools, was also found to be highly feasible. The brief notes that it builds on already existing health services at the clinic for children. During the D2P course, your team will be given a scorecard to assess the feasibility of each policy option you propose. It will be critical to refer to this card as you review your policy options. Your mentor and teammates will help you. Let's review for a minute so we can start to see the whole picture of what was in this policy brief. We can see our problem and its causes: deaths among children with undiagnosed HIV caused by low rates of HIV testing, which in turn has various root causes related to discomfort among caregivers and healthcare staff with requesting testing and non-routine testing. The CIDRS team identified 3 different policy options to address this problem: routine clinic testing for children, school testing drives, and school entry screening, and assessed their feasibility. but we still need to look at each from an economic perspective. That is, which option will give us the best outcome for the resources that we would need to put in to implement it. This is called an economic evaluation, and it's one of the topics we'll spend the most time on during the in-person component of the D2P course. You and your mentor will be working hard to gather data to answer this question. What do we put in, and what do we get out for each proposed policy option? The last page of the CIDR's policy brief includes a table showing the economic comparison of the different policy options. Options 1, 2, and 3 are shown across the top of the table, and the rows of the table show the different costs and estimated outcomes for each option. We can compare the number of HIV-positive children identified in 1 year, the number of lives saved in 1 year, the annual testing cost, the testing costs per positive child, the annual treatment costs, and the treatment cost per infected child. Seeing it laid out in a table this way enables us to compare the policy options side by side and make direct comparisons. The authors also chose, in this table, to include the political and operational feasibility of each option, so we can compare those side by side. As you can see, the authors estimated that Option 1 would save 1,288 lives each year, compared to 336 lives with Option 2 and 64 lives with Option 3. However, they also estimate that the annual treatment costs would be the highest with the first option and the lowest with the third. We won't review the entire table here. However, this is an excellent example of the type of work you'll be doing during the in-person section of this course, together with your mentor and teammates. Ultimately, you'll want to compare all the different options under consideration for your policy topic to see which one you want to recommend. There may not be a single clear answer, and that's okay. The purpose of the policy brief is to present information for policymakers and show them different ways they could act to reduce a health problem. At the end of your policy brief, you'll be making recommendations about which policy option is best and recommending next steps and requirements to implement it. In the CIDR's policy brief, they recommended reinforcing routine HIV testing at clinics to reduce the number of undiagnosed HIV-infected children. We've just seen that this policy option would prevent the highest number of child deaths if implemented. The authors noted that in addition to a legal framework and stakeholder collaboration, several other elements would be needed from the various ministries for this option to be implemented. At the time this module was being recorded, discussions were underway in Zambia to consider this policy option as a direct result of this policy brief and analysis. Many factors affect whether or not a policy will be taken up or its recommendations followed. As we mentioned before, political support plays a major role in policy. Sometimes policy briefs simply start conversations, while other times they're made into new laws or regulations. What happens with your policy topic will be the result of multiple factors, including the effort you put in, but also the current environment, competing interests, and available resources. Now you've seen an entire policy brief and reviewed many of the elements you'll learn in this course. At this point, you might be thinking that you'll need a lot of data to write your policy brief. And you're right, you will need a lot of data. That's one of the reasons we engage mentors and participants well before the class starts, to start thinking about data they'll need to gather. You'll be using data to demonstrate the burden of the problem, the affected populations and locations, the root causes of the problem, and the costs, impact, and feasibility of policy options. During both the online course and the in-person course, you'll be working to identify data needed for your policy brief from the published literature, unpublished reports, surveillance or other local data, stakeholder interviews, and many other sources. Enrolling in the D2P course is a major commitment, and none of us want to make a commitment without understanding fully what we'll gain from it. We've reviewed the elements of a policy brief and what you'll learn, but let's think about some general benefits of taking this course that might be of interest to you. First, and perhaps most importantly, this is an opportunity for you to have a real, large-scale impact on the health of your community or citizens. Remember, research provides direction, but policy is needed for large-scale change. You might write a policy brief that leads to real, life-saving actions and feel proud every time you see its effects. Second, the D2P training may result in enhanced recognition. You were selected for this course to be trained in policy writing. Having this training provides important, transferable skills that could potentially enhance your career opportunities. Third, you'll become familiar with news sources of data and start to see the connections between them and the gaps that exist. You'll learn how data are used or not used, and learn how they can potentially be used to conduct analyses such as economic modeling, which is often an unusual skill. Beyond this, you'll have opportunities to interact with and present data to people in your field who you might not have previously had access to. Stakeholder interviews and engagement are an important part of this course, as their opinions are what will either move your brief forward or, conversely, hold it back. Finally, this course provides cross-collaboration with colleagues who you might not meet or work with normally, allowing you to share skills and experience with each other and build your own capacity along the way. You'll discover even more benefits as you go through the course. So, once again, welcome. Let's get started.